Urethra. Urethra, the tube that lands from the bladder and transports and disses urine, uses the body. In males, the urethra travels through the penis and carries semen as well as urine. In females, the urethra is shorter than in the male and it emerges above the vaginal opening.
Next, urethra, internal urethral orifice, external urethral orifice, and that's it for the female.
Fusion. In males, the urethra is a tube that conveys urine from the urinary bladder to the uses of the body. In males, the urethra also functions as a urinary canal and as a passageway for cell and secretion from various reproduction organs. Urinary catheter. Urinary catheters are used to train. Some people use catheters to help them manage their bladder problems. A bladder catheter will be inserted in the urethra to decrease pressure of the bladder.
In relation to the procedure of transurethral bladder catheterization, this is a transurethral Foley's catheter. The tip of the catheter, which is inserted into the urethra and ultimately the bladder, has two openings which will drain the contents of the bladder through the central lumen of the catheter into a collection bag once attached. Remove the catheter pack from its wrapping. The catheter pack should be opened carefully, only touching the outside cover of the pack. Avoid touching the inside sterile part of the packaging. You may wish to create this sterile field either between the patient's legs or on a nearby mobile trolley. If no urine is draining, do not inflate the balloon. It may be that the catheter is in the urethra, in which case inflating the balloon will be very uncomfortable for the patient, or cause urethral injury or a false passage, which may lead to bleeding, sepsis, and possibly even death. The main difference of female catheterization over male catheterization is the functional anatomy of the genitourinary tract. The urethral meatus of the female is located anterior to the vaginal opening and may often be difficult to locate. Patient positioning is different from male. The female patient should be in the supine position with the hips and knees flexed and feet resting approximately half a meter apart.
Urinary catheter rests in place for months that a few days increase the risk for a bladder or kidney infection. If a urinary catheter is left in place for a long time, bacteria will grow in it. Disease. The urinary is tube that allows urinary to pass uses the body. In men, the urethra is a long tube that runs through the penis. In women, the urethra is short. Urethral problems many happen due to again illness or injury. They included urethral structure, a marrow of the opening of the urethra, urethritis, inflammation of the urethra, sometimes causes blood infection. Symptoms of urethral problems may include pain, difficult to pass urine, bleeding, or dysphagia.